Hello guys, welcome to my YouTube channel. I am Obadun Adirunke, and today I'll be talking about one of the airborne disease that we have, which is tuberculosis. And the last time on my video I talked about diabetics. So if you have not watched the video, please go back and watch the video and subscribe to my YouTube channel. So what is tuberculosis? Tuberculosis is an infection that usually attacks the lungs, but can also attack some part of your organ like the brain, the spine, and the kidney. So what causes tuberculosis? There is a particular bacteria that causes tuberculosis called Mycobacterium tuberculosis, and that is what causes you to have tuberculosis. And if you don't know, tuberculosis have been living with us for the past 3 million years. So which people are at risk of having tuberculosis? People with low immunity, like people with HIV and AIDS, because their system will find it difficult to fight the bacteria, so they are at high risk of having tuberculosis. And tuberculosis has types. There are types of tuberculosis. We have the active tuberculosis, we have the latent tuberculosis, we have the active tuberculosis outside the lungs, and we have the primary tuberculosis. So what is primary tuberculosis? And another thing you should know is, because you have tuberculosis does not mean once the infection enters your system, it will just show immediately. No. That's why there is primary, it has stages. Primary tuberculosis, this is when the bacteria enters inside your body, and when it is inside your body, because you have high immunity, your normal mechanism just naturally fights it out and the bacteria die in your body. The second stage of tuberculosis is the latent tuberculosis. This stage, now the virus is in your system, but because you have high immunity, it keeps them away from spreading all over your body. And this period is not contagious. It's called like the window period, when a disease just enters your body and try to dominate your body. So this time, when the virus is trying to find a way around your body, and one day it will become active. And that moves on to the third stage of tuberculosis, which is the active period. This active period, the infection is present in your body. And now, as it's present in your body, it's highly contagious, because when you go out and sneeze or cough, probably beside people who don't have the infection, you can easily infect them. And you have 90% chance of infecting others when the infection is now active in your body. So that moves us to the fourth stage of tuberculosis, which is the active tuberculosis outside the lungs. What it means is, the tuberculosis has already affected your lungs. Now, it's now moving outside your lungs. Not that it's no longer in your lungs, it's still in your body, it's moving outside your lungs, trying to dominate other parts of your body. This period is called the extrapulmonary tuberculosis, extrapulmonary infection. So it's going like outside your lungs, going to your brain to affect your brain, going to your kidney, your spine to affect all these parts of your body. And this period is very dangerous. So there are modes at which this disease spread in the community. Like I said, tuberculosis is an airborne disease. It spreads in the air. Now, how do you contact from somebody who is already infected? You contact it when the person talks, the person sneezes, the person sings, the person is laughing, or the person coughs. When they do all these things, they drop a droplet, they release a droplet of this bacteria in the air, and you inhale. Once you inhale it, you already had some particles of this infection, in your system. Then they will start growing from there. So I will advise you, when you see people sneezing, tell them to control the way they sneeze by sneezing at their elbow or using a nose mask. When you cough, you cover your mouth. You don't cough and you are infecting everybody with your cough, because all these things are airborne diseases and can easily be gotten from anybody. Now let's go to how to know you have a tuberculosis. You can only know through some series of tests. The first one is the skin test and the second one is the blood test. So the first skin test is called the Malthus tuberculin skin test, and this is where a technician injects little amount of fluid in your lower arm and leaving it for at least 2 to 3 days to check if it's swollen. If it's swollen, that means it's positive. If it's not, it's negative. And you can do this test more than 1 or twice. And the other one is the blood test. The blood test is also called interferon gram release assay, and this is when little of tuberculosis protein is mixed with your blood, and when it comes out gram positive, that means you are infected, and if it comes out negative, you are safe from the disease. Now, what is the treatment for tuberculosis? The only treatment for tuberculosis is antibiotics. That's the only treatment for tuberculosis, and it takes about 6 to 9 months before this disease and this infection, can completely leave your system, and you have to stay truthful to your drug. Now, with all the explanation from the beginning till now, if you have any question concerning tuberculosis, drop your comments under the comment section and I'll respond to it immediately. And thank you for staying with me. I love you. Don't forget to subscribe to my YouTube channel and tell your friend to tell a friend to subscribe to my YouTube channel. I love you and I'll see you in my next video. Don't forget, I remain Obadun Aderunke. I love you. Bye.